Hello, everyone. Good morning. Thank you for the introduction. I have nothing personally to disclose, but these are the disclosures to some of my co-authors. Enhanced recovery protocols and minimally invasive surgery have transformed how we manage patients postoperatively, especially in the field of colorectal surgery. Same-day discharge really represents the next step in the evolution of enhanced recovery protocols. And in fact, there have been studies that have shown similar outcomes after minimally invasive colectomy and stoma reversal with a mobile healthcare application as a method of follow-up. However, with any implementation in healthcare, we need to involve all stakeholders, including the patients. And so a survey-based study published in 2022 identified that over 85% of patients undergoing same-day discharge would do so again if given the opportunity. However, we don't fully have the patient's perspective on same-day discharge. And so the objective of this study was really to determine the patient perspective on same-day discharge following minimally invasive colectomy and stoma reversal. This was a qualitative study using purposeful sampling of adult patients undergoing minimally invasive colectomy or stoma reversal at a single center affiliated colorectal center. We included patients undergoing same-day discharge, and what this meant was that they went home on the same day as their surgery, and a successful same-day discharge was characterized as a patient who went home on postoperative day 0 and did not have an unplanned healthcare visit within 72 hours. All patients were administered a 13-item questionnaire over the phone, and our final sample size was determined by thematic saturation. Again, this is a thematically driven analysis in which themes were derived by an iterative process of subthemes following coding of general descriptions. We used a qualitative analysis software, and then quantitative data based on descriptive characteristics of our cohort was done retrospectively. In terms of our cohort, we had a total of 17 patients, 9 male, 8 female, with an average age of 52. 7 patients underwent stoma reversal and 10 underwent colectomy. We had 4 patients with a 30-day complication. And in terms of same-day discharge, 9 had a successful same-day discharge and 8 failed same-day discharge. On our analysis, we found 4 main themes, the first being a need for preparedness and foresight, the second being adjustment to the home care model, a third being comfort and return of daily function, and finally, factors really limiting that home care. So if we go individually, in terms of preparedness and foresight, patients really appreciated having a prehabilitation program. They felt educated by the surgical team, and they felt that they had the knowledge in order to care for themselves early in the postoperative period. However, there were some doubts. Some patients really emphasized the concern that same-day discharge is not a common practice, especially in colorectal surgery. They felt that they needed more time to plan and prepare who was going to take care of me postoperatively, as well as the financial burden of recovering at home. In terms of the home care model, patients felt very reassured when they lived in close proximity to the hospital. They felt as though the treating team was quite accessible in terms of that mobile application that they were discharged home with. They felt as though they had access to allied healthcare professionals in their community. However, they did express that it was difficult when recovering at home in terms of living alone. A lot of patients said they had to rely on family members or friends, or in fact pay somebody to care for them early in the postoperative period. And one big concern for many patients was really the difficulty of manning self-injectables or anticoagulation during the 28 days postoperatively. Another issue was the concern for wound care and healing, especially among patients who underwent stoma reversal. And in terms of diet, patients really had mixed feelings, where some patients really wanted more of a concrete plan of what I should eat and when I should eat this, whereas other patients really enjoyed that nutritional freedom and felt as though they were able to return to their regular diet more quickly. In terms of return to daily function, patients felt a sense of motivation being home with their family and loved ones. They felt like they were able to really get back into their daily activities more quickly. They felt that their family motivated them in terms of early ambulation. And another thing was that they really emphasized that recovering at home provided them with a reduced risk of acquiring a hospital-acquired infection, as well as improved privacy, less noise, and a lot of them mentioned that sleeping in their own bed, in their own house, led to improved sleep. In terms of factors limiting healthcare, again, the financial burden of having to have a caretaker at home or a loved one stay home with them was something that was often emphasized. Patients also needed an updated mobile device to use the application. And another thing was they struggled with not having that sense of security of recovering in a hospital where people are there 24/7. And another issue is that they really brought up the fact that when you undergo same-day discharge, if you did have to come to the hospital with a complication, there's no fast-track system, and so you're waiting in the emergency department for a while until you're able to see the treating team. And so if we look at some of the factors that patients struggled with in terms of waking up in the post-anesthesia care unit, one patient said, "It felt rushed. At least let me stay until I fully wake up before I leave." Another patient said, "I had to take off work and my wife had to take off work to care for me," in terms of the financial aspect. Another issue was there needs to be a protocol. If you had same-day discharge, don't wait in the ED. And as many patients brought up the difficulty with having to inject the anticoagulation, one patient said, "I had to self-inject an anticoagulant daily. That was the most challenging." And on more of a positive note, one of the patients said, "Eating my own food was much easier at home. We reached out to the team twice and they were very quick to get back. Going home was a good thing. It would reduce risk of infection." And another patient said, "Being home in my own surroundings was more comfortable." And so this is one of the first qualitative studies really examining the full patient perspective on same-day discharge. And what we found was that same-day discharge provides patients with comfort, early reintegration with their loved ones, and expanded nutritional options early in the postoperative period. However, some difficulties with same-day discharge included daily anticoagulation injection, having to wait in the emergency department if they had complications, as well as wound care management at home. That's all. Thank you very much for the opportunity of the podium.